And we have a better picture of what COVID-19 is going to cost Ontario financially. Today, the government released a mini budget, virtually, of course, to reflect the new pandemic reality. It is predicting that the revenues will take a $5.8 billion hit, and the deficit will double to $20.5 billion. The Ford government announced a $17 billion plan to help boost health care and ease the burden on businesses and families.
I promise you, we will fight and we will not stop fighting. The next round of that fight starts right here and right now. With $17 billion in new emergency relief and support.
Okay, here are the highlights for health. $3.3 billion more for healthcare. This is new money that includes a $160 million increase for public health, far different than last year's budget that cut public health. $75 million for personal protective gear for healthcare workers, and $243 million to create more long-term care beds. That's critical to free up more hospital beds. And up to 25% of people in hospitals at any given time should actually be in long-term care. But there's a 30,000 person wait list. And there's also $1 billion being released from the province's reserves to help boost health funding. But let me put that $3.3 billion of new money into healthcare into perspective. A year ago, the province's fiscal watchdog warned that the government would have to put in $7 billion over the next 3 years just to keep the current standards going. That's $2.3 billion a year. We're putting in $3.3 billion. So in essence, some could argue that's only really $1 billion above what many have been saying all along we should be putting into healthcare. I asked Premier Ford about this just a few minutes ago when he had an avail.
Hello, Premier.
Hi, sir.
A year ago, Ontario's fiscal watchdog warned that if you didn't put $7 billion more into healthcare in the next 3 years, that the system would not be maintained at the status quo. So that's $2.3 billion per year. You're putting $3.3 billion in to fight COVID. So, you know, in theory, $2 billion of that was just to maintain the current system. Is there going to be enough to fight the pandemic and have enough resources in the hospitals with $3.3 additional billion?
We're pouring billions and billions of dollars into the healthcare system. Before this crisis took place, we increased the budget in healthcare by $1.9 billion. That's more than any government in the history of Ontario. We're increasing it even more, billions of dollars to fight COVID-19, making sure that the needs of the healthcare frontline workers are taken care of.
Now, the government's fiscal plan passed immediately, keeping the current situation in mind for Ontarians. But the opposition was also quite vocal in registering their concerns.
New Democrats will support this bill and will allow it to pass immediately. But I am extremely concerned that the provincial government's financial statement fails to put money in the pockets of people that desperately need it and doesn't provide the help that small and medium-sized local businesses need.
The government is also making $10 billion of tax deferrals to improve cash flow for businesses and people. That includes $6 billion in relief for businesses, and municipalities will be able to defer property tax payments to school boards for 90 days. In turn, those municipalities can pass on $1.8 billion in property tax deferrals to homeowners and business. The NDP's request for $2,000 in direct relief payments is not part of the government plan.
We're very proud of what we brought together because we think that it represents a good first step, a start in terms of this province's reaction to COVID-19.